Hi, I'm Dr. Matthew Stay from National Pike Chiropractic, and today we're going to be talking about chiropractic's role in the postpartum recovery. Now, the miracle of birth is a very wonderful event. Bringing a child into this world and watching them grow and learn is a very powerful experience. However, the process can take a significant toll on the mother, and postpartum recovery can be very challenging. Not only are you learning to take care of your newborn, but you may also be dealing with a whole variety of potential issues such as lower back pain, pelvic floor dysfunction and misalignment, hormonal imbalances, fatigue and sleep deprivation, as well as a slew of other potential issues. Low back and pelvic pain are far and away the number one issue we see with the postpartum woman. The tissue damage affecting the abdominal wall and pelvic floor musculature can be extensive. This leads to weakness and instability of the lumbar spine. Furthermore, the hormones that allow the pelvis to relax during the birthing process remain active for up to 6 weeks post-delivery. This is why it's very important to incorporate spinal adjustments and pelvic floor exercises into your postpartum recovery to improve the flexibility of your spine and the stability of your pelvic floor. Hi everyone, so we have Nicole here. She's going to be our model for these next few exercises. Nicole is a first-time expecting mother, and so congratulations,
Thank
Nicole. So these exercises, we know we're talking about postpartum recovery, but they're also very important for the expecting mother. All right. So the first one we're going to do is just basic diaphragmatic breathing. So I'm going to have Nicole lay on her back, where they're going to have her bend her knees, feet flat on the table. And this is important because it aligns the opening of your rib cage with the opening of your pelvic inlet. So the goal here is to make sure that we breathe in diaphragmatically, make sure we're getting good excursion through the abdominals and feeling a lot of relaxation through the chest and neck. We'll go ahead and just breathe in nice and fully. Good. And you can really see that activity as she breathes in. Good. Now, sometimes for most patients, you'll notice even some activity in the pelvic floor. So, and that's what you want to start to feel, some of this excursion of those pelvic floor muscles pushing in, or pushing out from the pelvic floor area. Good. So that would be the first step in restoring your diaphragmatic breathing. So our next progression in restoring proper breathing function is what we call perineal breathing. So here we're going to take you from your back to the upright seated position. And we're going to have Nicole here place her fingers specifically in between the sit bones. So she's going to sit on her hands. She's going to have her fingers in that pelvic floor musculature. And all we're going to do is just focus on, again, getting a good diaphragmatic excursion, relaxing the shoulders and neck muscles as she breathes in. And the goal is for her to feel those pelvic floor muscles pushing into her fingers as she takes that respiratory inhalation. Go ahead and do that for me a few times. Good. And really just do a good job to try to relax those muscles and let that air push down into the pelvic floor area. And she'll tell you she can feel that little bit of pressure pushing into her fingers there. And if she's having trouble with that, then we want to peel it back and go back to laying on her back. Our third progression in restoring proper breathing is simple box breathing. All right. So we started on the back where we're supporting the spine, then we go to the upright seated position. Now we're getting on our feet and really focusing on using good diaphragmatic breath. So what we're going to do here is have her hands just simply on her waist. And I want you to think of this as a box. We're going to start with a 3-second box. So it's going to be a 3 seconds breathing in, a 3-second hold, 3 seconds breathing out, and then another 3-second hold, and then you're another back to 3 seconds breathing in, so on, so forth, like a box. And when you get comfortable with that, with 3 seconds, you can move to a 4-second box, and then to a 5-second box, and so on and so forth. All right, so we're going to have Nicole here just demonstrate an example of a 3-second box. So we'll do a 3 seconds breathing in, hold for 3 seconds, 3 seconds breathing out, hold for 3 seconds, and then restart the cycle. Breathe in for 3, hold for 3, breathe out for 3, hold for 3. One important consideration is that postpartum recovery is very much a multifactorial issue, in that there is going to be physical tissue damage, but there is also a potential mental health component as well. So if you are struggling with postpartum depression, postpartum anxiety, or postpartum rage, it is very important that you seek out the advice of a mental health professional to help develop effective treatment strategies. Thank you for tuning in for this week's video on chiropractic's role in the postpartum recovery. And don't forget to check back next week as we continue our pregnancy series and explore how a well-functioning pelvic floor can improve the recovery process. I'm Dr. Matthew Stay from National Pike Chiropractic, and we'll see you next week.